Hot flashes, mood swings, they call it the change of life. And yes, this is what women around the age of 50 experience as they go through menopause. Health specialist Leah Sarich is here now with how men go through menopause as well.
It's true.
Dudes.
I'm not going to lie to you.
Including me.
Exactly.
Soon.
This will happen to you. However, it looks very different in men than it does in women. That is the big thing. So yes, men do experience a change of life. Basically, as they age, their male hormone levels drop. So their testosterone levels will drop.
Okay.
But it happens gradually over time.
It's not like the sharp that
exactly.
women go
With
through.
women, it plunges around age
okay.
50. So for men, it's a gradual, very slow change. I spoke with Dr. David Lau about this. He's an endocrinologist, and he says that yes, in fact, menopause does exist.
For guys, the male hormone levels start to drop about, say from age 40 on, it goes down by about 1%, 1 to 2% per year. So by the time a guy is 70 years old, his male hormone levels may be half of what it used to be. But on the other hand, this depends a lot on the state of health of the individual and so on. And we do know a number of factors that can affect the male hormone levels.
Yes.
I'm 43.
Yes.
This is like...
It's imminent.
It's like right here.
It's happening right now, yes. So it's a very slow drop in the testosterone levels, for sure. However, in extreme cases, Dr. Lau did say that some men will in fact experience hot flashes and
they get the
swings.
sharp drop in them.
They will, yeah, but that's very rare.
Okay.
It's much more common that it happens very, very slowly. And so the symptoms that we talk about for men are much more vague. He outlines them for us.
Sometimes the symptoms could include feeling tired, loss of muscle bulk, and maybe perhaps a little bit more extra belly fat and so on. But these are all symptoms, and the important ones have to do with sexual performance and, importantly, a decrease in the sexual desire or libido.
So of course that can be age-related, but it can also be caused by other things like heart problems, diabetes, and things like that. So if you do a test to test your testosterone levels with your doctor, if you say, I've got these symptoms, this is what's happening, they'll look at you sort of big picture, right? They'll look at the big package. They're not going to think of male menopause right away for sure, because it's so uncommon. So for men that come back with low testosterone levels, very clearly, that's a pretty easy treatment, because what in fact they'll do is hormone replacement therapy, as they do for women.
Just like for women,
Exactly, yeah. So pills, gels, injections, they can replace that testosterone. But in most cases, Dr. Lau says that's not what's happening. It's actually so gradual that you're not going to get that obvious test result back. But he does say that there are a few things that men can do to reduce some of those symptoms if they're having those symptoms.
What can I do?
So stay slim. That's the first thing. Lose weight. He said, in fact, did you know that extra fat in men will turn from the male hormone into the female hormone?
To estrogen?
Yes.
Really?
Yes. So if you've got extra fat, that's happening in your body.
That's happening right now.
That is. So you're going to want to turn that around. Yes, for sure. The other thing is quit smoking. So if you're a smoker, quit smoking, because that's going to cause some problems. And don't do drugs.
Don't do drugs.
Those are all going to have an impact on your symptoms. So if you have any of those symptoms, you can do those things and you should see some results. So very much based on your lifestyle choices.
I did not know that menopause existed.
There you go. It is true. And
I'm going to have to talk to my doctor about this.
You might want to, right? That's a good thing to have a conversation about.
Well, I mean, you can get your testosterone level kind of, you baseline it, and then you just kind of track it from.
But that is one thing to point out, is that most men are not having their testosterone levels checked when they're young and virile, right?
Of course
so we don't have a baseline to compare it to. So you're not going to say, wow, it's really different from when you were 25. Yeah. Right? So yes, but the gradual decrease is very normal.
There you go.
There you go.
All this will be on your blog,
on my blog,
right?
you bet.
Breakfasttelevision.ca, click on blogs, look for Leah, and you're good to go. All right.